Transportation is on page 150 of the budget book, and we have had transportation under Health and Human Services for about a year now. In FY26, we have had several accomplishments. We have begun to stabilize the transportation program and to really look at operating costs and service needs, as well as what's the best use of the service for the community. Overall, for FY27, operating costs were reduced by 2.4%, reflecting a 1.8% reduction overall for the transportation budget. We did this by terminating the lease of our 2 CAT fixed route shuttles, which are the ones that go around every hour, which is roughly $31,000 a year in savings. And through collaboration with the Lowell Regional Transit Authority, we have been provided 2 surplus shuttles that have been made available to us to support our transportation efforts. These shuttles are maintained by the LRTA and issued and leased to the town at a minimal cost. These savings position us to support future expansion of transit services. We also migrated to a new software through My Senior Center and their Rides transportation module to increase ridership and also more accurate data collection. This is roughly going to save us around $8,000 a year for a much better, sophisticated, smarter software. In the spring of 2025, we did conduct a route efficiency study for both the on-demand and fixed route services. The study findings indicate a strong potential for increased ridership on the on-demand service, as well as sufficient capacity to add more frequent fixed route stops at the high-demand destinations, including the MBTA commuter rail. So what this is essentially saying is that we can add more service for the same amount of money and get more people on the bus. So that is a goal that we want to continue with. With this new software that I had just mentioned, between November and December, we've seen approximately a 15 to 20% increase in rides. So like our minivan had 13 more trips than they would have before, and the Roadrunner had 22 more trips. That's great, and the public has noticed it. The gentleman that we have dispatching for us said this computer software is finding things that I wouldn't see with my own eyes. So it's really going to be a big help. We also submitted a community transit grant application to the state to support our FY27 shared regional dispatch costs, and also a grant to continue with our mobility management study of fixed routes in regionalization. Penny and I have also set up monthly check-in meetings with our vendor to strengthen our partnership with them. They have kind of been on an island, and we're here, and we're trying to, reach out and let them know that we are here to support them, and I think that has been going very well. And the drivers are more involved with my office and day-to-day stuff, so they're more part of us now than I feel that they have been in the past. Changes and challenges. So even though we're finding ways to increase ridership, and we know that we can do that, expansion is challenging without funding. And we have emerging community needs. We have different populations that are needing transportation services that maybe 5 years ago weren't. Rides right now to medical appointments in the Council on Aging make up 70% of our scheduled rides. However, we are getting requests for employment-related transportation now, and also trips into Boston, to the Boston area hospitals. And also a goal is to continue to examine operating costs. I would like to continue with looking at our contract with our vendor and also re-examining the efficiency of the van operating hours to find out if it makes more sense to run them less time or adjust their time. So maybe earlier in the morning would make sense, and then later on the day when it tends to be quiet, we may not need service till 6 o'clock at night, but we may need service at 7 a.m. So we will continue to look at all that. And in FY27, we are going to begin to promote, well, it's open right now. We have just released a new Crosstown Connect website, crosstownconnect.org, and we also have new outreach materials. The website can translate in over 100 languages, and all required policies to follow Federal Transit Administration requirements are now posted. And these are policies such as ADA discrimination complaints, how to file them, and also Title VI. It also received a score of 100 under the Web Content Accessibility Guidelines. And we're looking to promote Crosstown Connect as an overall service. It's been in the past, different van names, different hours, different populations listed as who can ride these vans, and it's just confusing to most members of the community. I'm afraid to call. What if I get on the wrong van? I don't know what to say. Can I take this van? And we want to stop marketing the service by each individual van and just Crosstown Connect. And you call the dispatch number, you tell the dispatch staff where you want to go and at what time, and they'll make sure that you're going to get on the right van. You don't have to worry about population, age, or anything like that. So we're looking to be promoting transportation as just Crosstown Connect. And we hope that it reduces hesitation to use the service and increase ridership. We have increased our ridership by 3%. We did 10,743 trips last year, and we're looking to increase that again by another 3% this year. And we also want to convene with our regional partners, including the Lowell Regional Transit Authority, the Metropolitan Area Planning Council, along with neighboring communities to expand our regional influence in coordination of the transit services.